It's LaTanya Eggleston, and it gives me wow. First, let me just say wow to this fantastic film that we just received a small excerpt from, this documentary, so powerful. And I want to say thank you and welcome to everyone who is here today. My name is LaTanya Eggleston. I am a professor and a coach, and I am here representing NAMI Maryland, which is National Alliance on Mental Illness, the state of Maryland. And we are so happy that you are here. We have an amazing panel I'm looking forward to introducing. I want to first say, give yourselves a huge round of applause for being here today at this Caregiving Expo. Yes. So it gives me great pleasure to introduce this esteemed panel to discuss the screening we just saw. To my immediate left, we have our Secretary, Carmel Roque, with the Maryland Department of Aging. My first impression of her was very committed and passionate. And I'll give her about 30 seconds, maybe 60 seconds, to explain and share a little bit about her background and why she's here.
Good afternoon, everyone. It is a real pleasure to be here with you. And I guess the best way to summarize my background is that I have spent my career, it's really my vocation, caring for older people, their families, and their care providers, both paid and unpaid. And I have had the great joy of being able to work in the sector that serves older people, their families, and care providers, and to be able to, at this point in my long career here in Maryland, center the well-being of older people, their families, and caregivers in all of the work of government. And this, to me, is one of the most important moments in my long career, and I am so grateful to be able to be representing all of you in the Moore-Miller administration.
Thank you for being here, Secretary Roque. Then to your immediate left is one of my board members for NAMI Maryland, Insha Hamdani. We want to thank you. And let me just say, this woman, working with her over the last couple of years on the NAMI board, has just really inspired me, and her commitment to not only the servicing and supporting our residents here in Maryland, but even her own family in this space. What would you like the audience to know about you?
Thank you, LaTanya. So I'm professionally a public health professional, worked with Hopkins for the past 10 years. The reason to enter into public health was personal. I was born and raised in a country where there were systemic inequities in terms of access to resources and opportunities. And so that is why I decided years ago that health is going to be one of the areas where I'm going to try and contribute to whatever efforts are being made. So that's one, but I'm also a caregiver. A loved one of mine suffers from mental illness, and as much as it came as a shock, it is something that we've had to work around and work with and accept and move on. And ever since I found NAMI Maryland, it's been a game changer, because now I know I'm not alone. And what we just watched, such a powerful documentary. Caregiving is a very isolating responsibility, so I'm glad to be part of this discussion. Thank you.
Thank you and welcome. And our third panelist today is Jennifer Eastman with the Maryland Commission on Caregiving and the Department of Disabilities. My first impression of Jennifer today was just of service and being very supportive. So we would love to hear your background and what brings you here today.
Sure. So I have been with the Maryland Department of Disabilities, serving as the Director of community living for a little over 10 years, and we focus on disability policy coordination across state governments to ensure that the services and supports that all agencies throughout Maryland state government are considering the diverse needs of people with disabilities, and that people with disabilities are receiving services in the most integrated setting. I also have served on the Maryland Commission on Caregiving, representing the department since the full term of me serving within the department, and I had the pleasure of serving as chair for 6 of those years. And the commission is a governor-appointed meeting body that is focused on promoting caregiver-friendly policies, and we're just trying to kind of represent the voice of the caregiver. And we've been able to conduct a survey, and we're working very closely in collaboration with the Department of Aging to help them carry out their grant that they have with the Administration for Community Living.
Thank you so much. So to the audience, when the viewers watching the replay, we have a list of questions that our panels will answer, and we'll also make it open to other panelists who want to chime in. The first question is for you, Secretary Woke, forgive me. What does the film reveal about the hidden cost, emotional, physical, and financial of caregiving?
I think for me, it resonated personally, and I think the statements in the film about the fact that caregiving is typically viewed as an individual responsibility or an individual family responsibility, and not something that actually is a concern for all of us across the full life course. So as a young person, when I was in high school, my mother was very ill for a period of time, and I really felt completely isolated by that experience. I didn't know I was being a caregiver. My mom was sick. That's all I really knew. And it went totally unrecognized, and it was an individual family concern. The same actually was true many years later when my mother-in-law was diagnosed with Alzheimer's disease, and my husband, an only child, was responsible for all of her care. And once again, that sense of being isolated and about this is just about us and we need to figure out how to deal with this was really pervasive. And I think that we really are at a point where we must begin to sort of return almost to understanding that this impacts all of us, that the social care network is something that, yes, government should be a part of, as well as all of the sectors. With 60%, with a quarter of our population over the age of 60, it is all of us. It isn't something that just impacts those people over there. So that really resonated for me, that if it's so deeply personal, and yet it really is something that impacts all of us.
Thank you for that, Secretary Roque. And you mentioned that isolation, and we want to acknowledge also Maryland Public Television. That's why this Caregiving Expo is so important for caregivers out there and family members who are feeling that isolation that you identified. This being here today is introducing you to the services and support systems that are in place, and we hope that you do find what you need here. Thank you for that. Our next question is Insha with NAMI, or I might comment too. What kind of sacrifices or compromises, you mentioned, do caregivers often have to make? And that maybe those sacrifices aren't always acknowledged in our society.
Yeah, thank you for that question. I just want to talk about mental illness, because mental illness is, I want to say in my experience, still an issue which is kind of shrouded in some level of stigma. So there's an additional layer, in my opinion, when it comes to mental illness and being a caregiver for mental illness. And throughout, with my experience, what I've seen is that the isolation really starts with the family and the person themselves, because there's, and unwittingly, caregivers will also perpetuate that stigma because of the shame that is somehow associated with it. I know it's not easy to talk about Alzheimer's, but I want to say that it's a little bit more difficult to talk about bipolar or clinical depression. So there's another layer and another level of isolation that comes with being a caregiver for somebody in your family or a loved one who's suffering from mental illness. And so this Caregiving Expo is especially important because we then can say and share with each other that you are not alone, I am not alone, we're in this together. And to your point, that this is isolating to be a caregiver, but then an illness, which is a mental illness, like I said, it kind of adds to that isolation.
Thank you, Insha. And I could relate with the young man going to high school in the film, for those of you who saw that. Being an educator in Maryland, I have students in my classroom that struggle with showing up for class because they're caregiving for a family member, and or when they show up being very distracted and just wanting to do well for the family. And that's what they call maybe a sacrifice. It's like, I'm here to get my education, whether it's high school in a new school or if it's in college, and then knowing that loved one is home. And so NAMI, I found NAMI through my students at the college. We offer service learning programs, and I was just amazed at the strength and the resilience that my students were showing because of the support groups that NAMI offers and that peer-to-peer that NAMI offers. And that was about 8 years ago, and I haven't looked back. I have been a part of every aspect that NAMI has because of it started with me knowing in the classroom what students were struggling with before they even got to my content. You know, they can't do the work if they're not showing up without basic needs and love and support and that worry from their family members' conditions. Yeah.
Can I add to that?
Sure.
So, yeah, sorry, I realized I never spoke about the sacrifice element or the compromise element. And I think NAMI and NAMI's programs and the fact that NAMI exists is absolutely essential and vital to people like myself and to everyone who's looking for any kind of support. And the interesting thing about NAMI is that you can get involved from any angle, as a caregiver, as somebody who's interested to give back. If you want to join advocacy, there's an advocacy training program. You can become part of the advocacy movement around policy on how we can have more friendly policies for people suffering with mental illness and caregivers. If you want to just talk to someone, there's a program there. If you want to facilitate a conversation of a family or caregivers, there's a program there. If you want to just pick up the phone and speak to someone and are feeling particularly vulnerable, there's 988. You pick up the phone and you call. So speaking of sacrifice, yes, but there is sacrifice, and it is so reassuring to have somebody says, we see you, we hear you, we are with you, and we're going to support you. So to me, NAMI has been tremendous in the way it's a support which doesn't touch one aspect of one's experience, but really is an all-round support mechanism.
I just want to build on that a little bit, because I think the pieces that you just lifted up about what is it that can make a difference for caregivers, you know, we sort of silo things into the disease of the week or, a certain segment of the population. But more and more, particularly the work we're doing at the Department on Aging, we're looking at this issue of caregiving as being full life course, impacts all of us, isn't really just about Alzheimer's disease or Parkinson's disease or any of the other mental illness, but is really about the phenomenon of care. So the central issue is, how are we, individually, as family members, and as a society, caring for one another? And I think the degree to which we can kind of universalize the experience, all of the things you talked about with NAMI are true for Alzheimer's, are true for any other kind of situation that puts you in the role of caring. And that includes government being in the role of caring. And I think that's something the film explored a little bit. But, right now we are living in times where some of the safety net is really being perhaps dismantled. And that's something that's very important for us to be considering as we elevate the fact that in Maryland right now, there are 760,000 caregivers. That's a big segment of our population. And they're caregivers for lots of different reasons, but they share the fundamental issue. So thank you for raising what you did about that.
Thank you, too, for that comment. And the next question, Jennifer, in fact, you brought up a question about, the support. Secretary Roque, you brought that up. My follow-up question here includes, well, what are the best ways to ensure caregivers have access to affordable respite care, support groups, and services that can reduce their burden?
Yeah, I think the first thing is to raise public awareness of the caregiver experience and to put a name to the role that so many people fill without even recognizing that that's what they do. So public awareness, normalizing the term caregiving, having people adopt it and say, yes, that is actually what I'm doing. And also to target organizations and sectors that are kind of outside the health and human services sector that we're so accustomed. So think outreach to businesses and chambers of commerce, and get the caregiver experience kind of adopted by all of those entities that are outside of, the health and human services realm. Making sure that resources are available and published and easily accessible. Also available in different languages and making sure that they're culturally competent. And then make respite time meaningful for the caregiver. I heard about this research study that the University of Utah put out called Time for Living and Caring. And what they did was they provided study participants with a calendar each week to input respite time. And then they also partnered that person with a virtual coach that could help them with assessment, goal setting, and goal review for each respite activity planned. And what they found was that participants reported satisfaction with the respite time that they did allocate each week. And then they actually increased their allocation of respite hours as the 16-week study passed along. So not only is it good to just say, have a friend come and give you 2 hours of the day off, but it's what are you going to do with those 2 hours, and do they fill your cup? And sometimes it's just sleep, but other times it's getting your nails done or going out to lunch with friends, but it's being intentional with the time that you are given to step away and to remember who you are as a person outside of your caregiver role. So those are just a couple things.
That is fantastic. Thank you, Jennifer, for that addition. It reminds me of Maryland, NAMI Maryland hosts a mindful moment on Monday, every first Monday, which is free virtually at 6:30. And it gives people that opportunity to just pause for a moment. But what I loved, what you just mentioned, was being intentional with that respite time. And I want that study. I want to have a copy of that, if you don't mind sharing that. So thank you for that. So the next question, it can go to perhaps Secretary Roque. How can policies and programs support intergenerational caregiving, including the role of younger generations in caring for older family members?
Well, this film was a great start there. I think I'm going to start with what it is we know. And one of the reasons I do that is because I'm struck by the fact that anecdotally and individually, we seem to understand about caregiving, but we don't have a great way of understanding it across the full spectrum of society. So one of the things that we know, it has to do with the demographics, and these are national figures, but Maryland tracks very closely. So 94% of care for adults is what the 1 in 4 caregivers in the country are doing, and 1 in 3 of those caregivers is under the age of 50. Caregivers are, of course, as diverse as all of our society, but we do know that almost 30% of caregivers are in what we call the sandwich generation, parents and children. So they're in the middle, straddling both generations. We know that caregiving has increased in its intensity and complexity, and this is something that I am deeply concerned about, which is over 40% of caregivers now provide what we think of as high-intensity care. And they do that with no training and no support. And I'll give you an example. When someone is ready to leave the hospital, frequently the family is provided with, these are the instructions you have when you leave the hospital. And then you take your loved one home, and maybe for the first time in your life, you're responsible for someone not getting a bed sore. Well, you know, we train people, and they work in 8-hour shifts to provide turning and positioning in a nursing home. But we're going to send grandmother or mother home, or a spouse, and say, now you do that. And, oh, well, there's a video you can look at that shows you how to do it. And it's not just that kind of care. It's tracheotomy care. It's a complex medical regimes where there are 29 different pills, and you have to know how to give them and when to give them. How do you keep a person who's having trouble swallowing from choking? All of these very complex things. And we give families no real support. So we're getting a little bit better at it, in that the healthcare system is starting to recognize that if you don't want a patient to return immediately to the hospital, you've got to do a better job of making sure that family is supported at home. We also know that there's a tremendous health and financial strain on caregivers, and that was lifted up in the video. Over half report negative financial impact due to caregiving. And part of that is because I know we don't talk about this very often, but most caregivers work. So they're doing both. And we saw in the film, maybe they're out on FMLA, family medical leave, but they're not getting any income during that period of time. Their job is protected. Many caregivers find themselves in a situation where they need to drop out of the workforce. And if you drop out of the workforce, it directly impacts your lifetime economic well-being. Can you save for retirement? Do you ever make up those lost wages, et cetera? So it has that impact. We also know, and this is really important, that caregivers have a high incidence of depression and anxiety that is unrecognized and untreated, often unrecognized by the caregiver. They just think it's hard and I'm doing it, you know. And there is a workplace impact. 7 in 10 family caregivers are employed, and many lack access to supportive benefits of any kind. Especially, and I love this statistic, 18 million hourly wage workers. So we also know that paid caregivers struggle to have benefits that meet with their needs, pay that meets with their needs. 11 million caregivers receive some compensation now through Medicaid, VA, or other state programs, which I must lift up, are now directly under assault from the federal government. So one of the few payer sources are being eroded. That social care safety net is being eroded now. So I think those are issues that directly ask for policy response. And you know, we don't have magic wands. This is a very complex issue. What we're doing at the Department on Aging is saying this will take all of government, multi-sectors, and elevating the importance of the issue into the public consciousness and into policy and lawmakers' consciousness. And that's one of the big things that we're working on now.
Thank you so much for that. Jennifer, maybe you would like to add to our next question around how our government policies better address the growing gap between care needs and caregiver availability.
Sure. So I think, and piggybacking on what Secretary Roque said, we need to do a better job of compensating direct care workers, providing a career path for them so that they can stay in the field longer and that there's less turnover and burnout, provide them better training. Residential service agencies, which are the entities that provide the direct care to Marylanders who qualify for the service, the reimbursement rate for Medicaid is $23 an hour. That goes to the agency. From that, the agency has to take out money for, you know, unemployment insurance and all those other employee deductions. And so how much do you think that the actual person who's providing the care takes home? $15, $16. Could you live on that? I know I couldn't. So better compensation for them. Provide stipends or allow programs for family members to provide the direct care under those programs. And then also collaborations between providers, employees, and state government. So within the Maryland Department of Labor, there is a direct care workforce innovation program. And it's administered, what it does is provide matching grants to organizations that are committed to training and placing direct care staff. Currently, the budget's only $250,000 a year. And I don't believe that they made any of their allocations in this fiscal year. So finding out what programs do exist, putting pressure on the legislators to fund it more adequately. And then another strategy is to develop matching service registries. So having state agencies create platforms by which caregivers can search for care in their area or maybe specific expertise or need. And then that way caregivers can be matched with care providers that provide the unique needs and offer competent care.
Thank you. Just a couple of more questions here. And how do you believe, and this can be any of the panelists, this next question, how do you believe technology can help solve some of the challenges of caregiving? And then what about some of the ethical challenges or considerations around technology and caregiving?
Well, I'll start there. I think, you know, what I say repeatedly to myself, technology is our friend. But we need to find ways to really ensure that, in fact, technology is our friend. And so we've seen some amazing things care that is delivered in the home through Zoom. So you can have a medical appointment now, and you don't have to get in the car and drive to the doctor or whatever. If you live in a rural area or a place where there's a shortage of specialty care, that is one way in which you can now receive care. That is tremendous. There are lots of complications around that. It's a way to, I think, potentially reduce social isolation, but it's not a silver bullet. So I do get concerned when we get very, very excited about the opportunities that technology offers us for there to be more communication between families and caregivers and specialty medicine and you know, the other kinds of things people need, without acknowledging that using technology means you have to have access to it, which not everybody does. And you have to know how to use it, which not everybody knows. And there's still a piece that has to do with human beings supporting one another, and that's frequently not really addressed. I think also one of the things that we need to pay attention to, and this is way above my pay grade, but it's still something I am trying to learn as much as I can about, which is how will this artificial intelligence boom impact the way we relate to one another, the information and education that is provided to people, and generally the way information is collected and used about us as individuals. And I think, you know, you all read about this, I know, and this is one of the things we're really aware of at the Department of Aging, is that we've spent a lot of time telling older people in particular, don't give out any of your personal information, ever. That's how scams happen. And then we turn around and say, fill out this form online with all of your personal information. And we give our personal information when we don't plan to frequently also, because of the way technology operates. So I think while this is just, there are just terrific opportunities, we do need to understand that the technology is an adjunct to people being engaged with each other.
I can just quickly add from the mental health perspective, I think, like you said, it has advantages, but we also have to be really careful in terms of regulation around it. I know that mindfulness apps have been really useful. I know that technology, having information and some sort of resources available online is very important. I know that there's an app that even NAMI is also the Prosper app. But yes, there is that underlying care that we have to take in terms of how are we using it, who is using it, and if we go in fully informed of what the pros and cons of using technology is. So yes, there's definitely a lot of potential there. It's a matter of being careful about how we move forward.
Yeah, and if I could put in a pitch for the Maryland Technology Assistance Program. It's a federally funded program that is under the Department of Disabilities. They do assistive technology loans and demonstrations. They also have a financial loan program, so you can borrow money at a reasonable interest rate to finance a new piece of assistive technology or adaptive equipment. And just to kind of add that, you know, in addition to remote monitoring, wearable fall technology is really important. There's smart medication dispensers that can, you know, you program it and then it administers medication to the person at specific times each day, and even robotic pets that foster companionship. So there's a lot of resources available. Also, the Department of Aging has a durable medical equipment reuse warehouse located within Prince George's County. So instead of paying out of pocket for something, you can certainly get it from their warehouse for free. And I heard that their inventory is through the roof. So There's a lot, but when it comes to assistive technology, yes, it's not a replacement for human interaction, it's to supplement, and start gradually and adapt technology that already builds into the person's routine. Don't try to put too much too fast, and you'll kind of build up self-efficacy and confidence that the person will adopt it well. So there's a lot out there, but start small.
Thank you. You probably have noticed additional resources are on the screens for you to take a picture of it if you'd like, or take notes of additional resources. As we are preparing to land the plane on this wonderful panel, I, just been so inspired by just your comments, your expertise, your backgrounds, and again, with a thank you to Maryland Public Television for hosting this Caregiving Expo and showing parts of the film. What do you want this audience, and this question's for the panel, and I'll answer it as well at the end. What do you want the attendees to really take away from your presence here today? You took your time out of your schedule from your families to, share your expertise, your experience, your thoughts. What would you say is a takeaway you want them, the attendees, our caregivers, to walk away with because you showed up today?
I'll start. First of all, understand the benefit of coming together like this so that we are right in this moment reducing our social isolation and elevating the importance, with the help of MPT, of caregiving. Also, this is not about us and them. This is about we. We are all caregivers across our life course at some point. And, you all know the famous quote, we will, be a caregiver, receive care, at some point, it's all of us. And I think the last thing that I really want people to understand, and this is an example of it, the coming together here, we're the ones that created the programs and services and systems that right now aren't working all that well. We can create new systems, programs, services, and supports, or we can redesign the ones that we have. And that is something all of us can participate in, and it is something that must happen, and it will happen. And we are the architects of that. We don't want to leave that for someone else. That's for us, the people who have the lived experience, to be the ones who are in charge of. So I'm so grateful to be here today, and thank you, MPT.
Thank you for that. So I would just say if everybody could remember three things. The first is the number 988. It's a helpline. If you are feeling vulnerable, or if you know that somebody's feeling vulnerable, please just pick up the phone, and if you can remember 988. The second thing, if you could remember, is NAMI.org, NAMI.org. If you have a question, if you're curious, if you're disturbed about something, log in if you can, and you will find so many resources that will give you a great starting point. And the last thing I would request everybody to remember is that you're not alone. Definitely not alone. We're all in this together. Thank you.
I would want to say two things. One kind of addresses the state of the federal administration and all of our social safety net programs. We don't know what's going to happen over the next several years, and I truly am concerned. But find your community, find your people. Faith-based communities are a great place to start. You're really going to have to make do with less. So if you can come together and meet the need locally, then I really think that that will be your best bet to weather the storm. And the second thing is advocate. Know your know your experience and speak up for yourself and speak up for the person that you care for. I had a horrible experience when my dad was receiving hospice, and being in the disability field where we tell people with disabilities, you have to speak up for yourself, you have to speak up for yourself, I could not believe how silenced I felt in that experience. And so trust your experience, trust your voice, and assert yourself even when it feels very hard.
Thank you so much. And as a certified coach, my takeaway, and I want each one of you to remember your core, who you are. My core values brought me here today: love, service, and fun. I believe in my service to the community, to NAMI Maryland. I believe every day there's something to have and find joy in. So that's the fun. And this is fun. I know we're here for a serious topic, and I'm enjoying meeting new people, the vendors that are here. Jennifer said, your community is here. You can connect with if not all, one person, one group that is here to support your needs. And there's always fortune in the follow-up. I share this with my students. What are you going to do with the information you take away from today? So please follow up. Don't go home and be isolated again and be, we have Insha mentioned that 988 NAMI Maryland, we do have a table. So I know we put a lot of information out here about our free services, the peer-to-peer, family-to-family. We have a list at our table with all the programming, and Insha also provided you with our website. So I am Professor Coach LaTanya Eggleston. We want to thank Secretary Roque, Insha, and Jennifer for being here today. Let's give a huge, warm round of applause. Thank you, MPT, for all that you do for our community as well. Continue to have a fruitful day, everyone.